This is Kristen Astorga. This is my video diary 1 assignment for patient-provider communication class, Comp 3321. I'm answering the questions. Number 1, how would you describe the patient-provider encounter? I would describe the patient-provider encounter as cold and rushed. I felt the patient uncomfortable and needed respect and dignity from the provider. She was interrupted mid-conversation several times. This approach is a part of the Western medicine approach, in which the doctor takes on a role as the relational communicator. The way the physician took on the way the patient was talking to the way the provider was talking to the patient was a physician-centered communication, and that's where the health professionals do most of the talking. Based on the reading, they choose conversational topics and begin and end communication episodes. An example is when the patient decides to leave the doctoring to the provider, since they are the professionals. How does this provider approach? Number 2, how does this provider approach to diagnose and treatment impact the interpersonal relationship of these two individuals? This brings a lack of trust between the two individuals, the patient not wanting to trust the doctor as far as their medical concerns. If the patient feels like they're not being listened to, then they aren't going to want to share that with the doctor. Also, this can impact the patient's thinking, make them feel like they are being belittled. The passage on the reading, it says, critical theorists such as Alexandra Todd point out ways in which some doctors patronize patients, treat them as if they're inferior by withholding information, speaking down to them, and shrugging off their feelings as childish or inconsequential. Many of these episodes involve transgression, which are episodes in which a doctor or a patient acts inappropriately. So, that being said, the patient could feel, like I mentioned, belittled and not want to speak up or not want to take care of their health care because of those types of relationships. Number 3, what are the nonverbal behaviors and environmental factors that may be contributing to the patient's attitude, perceptions, and communication? The first nonverbal behavior was startling the patient, which automatically puts the patient in an intense situation. By the provider opening the door suddenly, the patient said they were startled and cold. So at that point, the patient's already uncomfortable. And the fact that the doctor just kind of said sorry and kind of moves on to the next aspect instead of showing any empathy towards that. This shows the patient is uncomfortable. The provider does not explain that he is going to examine her abdomen and just motions with his hands for her to lay back. Instead of asking if they could raise the patient's gown, the provider just exposed her in her underwear, which can be very embarrassing and put that patient in a negative feeling situation. The number 4 question says, identify an example of the provider's communication behaviors that contribute negatively to the communication exchange, and explain. One provider's communication behavior that contributed to this was the communication exchange was the fact that the provider is using the doorknob disclosure by having one hand on the door and asking if there are any other questions. The negative part is the provider who too quickly diverts the conversation may lose an an important opportunity to learn what's on the patient's mind based on the readings. Yeah. Number 5, what would you recommend to help build trust in this patient-provider relationship? I would definitely do the collaborative communication method, which establishes patients and caregivers as peers who openly discuss health options and make mutual satisfying decisions from the text that was read. This type of communication helps the patient feel as they have some say about their health. Being involved with the patient and a provider, involving themselves in their own health actually is positive in my eyes, since it helps feel like there's control there. If the provider would have knocked on the door before entering, it didn't say. I feel like they could have knocked. Just that it gives the patient some respect. Another was the provider should have explained they wanted to examine the patient's stomach, abdomen, instead of just motioning for the patient to lay back mid-conversation. The fact that a provider can definitely take a moment to tell the patient, okay, I'm going to go ahead and examine your abdomen. If you can please lay back, and is it okay if I pull up your gown so I can examine? And I'm going to go ahead and palpitate, which is pushing on your abdomen in certain areas, and you let me know if it hurts. That just something like that makes a big difference. Part 2 for my reflection. It says, describe a time when you interacted with a provider, physician, pharmacist, dentist, nurse, therapist, etc., and you felt dismissed or dissatisfied with your care. This actually happens quite often. It happened a few times with my daughter's pediatrician. Every time we visit, she spends about 2 minutes with us. She always asks if she has her flu shot, if I've had my flu shot. She takes time out of her way specifically for that, so she can charge me. Not just my daughter, but always me. I barely get anything since her nurses have already told her what we're there for. So for example, one time we had a sick visit where my daughter had a runny nose, fever, and cough. This was my first child, and I was not sure the best way to treat. She walked in, she said that she has a cold, gave me a paper, and was on her way out. I explained that she had been sick for many days already, and she just pointed to the paper that said a cold can last 1 to 2 weeks. As she has her hand on the door walking out, which is the door knob disclosure, I learned a few years ago. She explained, I asked her while she's, one hand on the door walking out saying, do you need anything else? I asked about, well, what about antibiotics? Does she need antibiotics? Does she need a prescription? She explained that she could write me a prescription, no problem, but since it's not that type of infection, she didn't need it. And then went on to say about prescribing antibiotics for children was the reason more children are being resistant today. I understood this, so I said, no, it's okay. I don't want it if she doesn't need it. As I was telling my husband, he asked me, what about the other problem she had? I totally forgot, since I felt hurried, felt like we weren't important enough to be listened to. It says, what happened and why did you feel that way and how did I resolve that? The next time we went, I brought my husband because she continued to be sick, and it was 14 days later, thinking that it would make a difference. He felt the exact same way walking out of there as I did as I did before, since the doctor did the same thing to us again. she proceeded to give me a paper, the same paper that she gave me last time, but I had to explain that this is our second time there and she wasn't getting any better. So one foot in, one foot out, as always. Before you know it, she's gone. Now I have learned to make a list of the things that I think is important and make it quick, simple, and easy. So as she's walking in, I'm telling her I have, we're here for a sick visit. I have a few questions as well as of some other problems. And she takes a moment and I just tell her straight right then and there, so I'm not wasting her time or my time, which I do understand now. Um, and since then, ever since then, I was able to get what I needed from her, and then also now she has a lot more help. So she has PAs that help her, and they take way more time than she does. They sit, explain, um, you know, what is going on with my kids, or what's going on in the body, and lets me know what could or couldn't happen, or what I can do and what I can't do. So that made a big difference. um, that's it. I hope you enjoyed it. um, in this COVID-19 era,